Hello, and welcome back to Medicinal Herbs Discovered. Today we will be talking about hibiscus. The herbal name for hibiscus is Hibiscus sabdariffa. Let's start by taking a look at the plant. Hibiscus is a shrub that grows 2 to 3 feet high and 2 to 3 feet wide. It has yellowish white flowers. After petal drop, a deep red calyx is left. This looks like a flower bud. The medicinal portion of the hibiscus plant is this calyx, which grows 1 to 3 inches in length. Now, let's look at the actions and constituents of hibiscus. Hibiscus is a very antioxidant-rich herb. It also contains quite a bit of vitamin C. It is a sweet, astringent, and cooling herb with a flavor similar to cranberry. In Ayurvedic medicine, hibiscus increases pitta and kapha. The first recommended use for hibiscus is to lower blood pressure. Hibiscus lowers both the systolic and diastolic numbers in the blood pressure reading. The systolic, or top number, signals how hard the heart is working to pump blood throughout the body. The diastolic, or bottom number, is the pressure in the heart while at rest. Hibiscus lowers both numbers in the blood pressure reading by increasing oxygen availability to the cells, as well as helping to increase pliability of the arteries. So who can benefit from this property of hibiscus? People at risk for heart disease, such as those who are pre-hypertensive, that is, with a creeping blood pressure. A second recommended use for hibiscus is to reduce bacterial growth. Hibiscus does this by attacking the bacterial cell walls, which leads to the death of the bacteria. This can be helpful to people with some GI conditions, such as stomach cramping, flatulence, and diarrhea, each associated with the bacteria E. coli. Since hibiscus decreases the bacterial growth that causes these conditions, it helps to improve their quality of life. A third recommended use for hibiscus is to reduce the blood fat levels and the accumulation of fat cells within the body. Hibiscus accomplishes this by increasing the good cholesterol, HDL, and decreases the bad cholesterol, LDL, and triglycerides. Hibiscus also breaks down the fat in the liver. This is helpful for those trying to lose weight, especially those with diabetes and metabolic syndromes. So where does hibiscus grow? Hibiscus grows in full sun and is a perennial within grow zones 8 through 11. It is also an annual in grow zones 3 through 7. Hibiscus prefers 12 hours of light along with 12 hours of darkness per day in order to promote flowering. This flowering is what leads to the production of the medicinal calyx. When reviewing this grow zone chart, the perennial zone 8 is pink, 9 is red, 10 is yellow, and 11 is orange. As an annual, we see grow zones 3 through 7, 3 being light blue, 4 being black, 5 being green, 6 being light green, and 7 being light pink. So when and how do we harvest hibiscus? Hibiscus blooming takes place in mid to late October. The fruits mature throughout November and December. After petal drop, we can harvest the calyx or bud of the flower. So we have grown and harvested our hibiscus. Now, how do we preserve it? We can preserve hibiscus by drying it to use in teas. We can decoct it in syrups, tincture it in alcohol or vinegar, or preserve it in jelly to put on our toast or English muffins. Hibiscus is considered a generally safe herb, but if taken in excess, Hibiscus can produce laxative effects. Hibiscus should be avoided during pregnancy since it can stimulate menstruation. Hibiscus should be used with caution while breastfeeding, although some data suggests that hibiscus can increase milk production. So, you want to try taking hibiscus medicinally. Here are some other medicines that are incompatible with hibiscus. These medications include blood pressure medication. In medicinal doses, hibiscus has the ability to lower blood pressure as well. So using medicinal hibiscus in conjunction with blood pressure medicine could make blood pressure drop too low. Hibiscus will also be problematic for those taking chloroquine. This is especially common in areas where malaria is present, and chloroquine is being used to treat malaria. Since hibiscus will lower the blood concentration of chloroquine, it may possibly cause chloroquine to be ineffective. Seizure medicines are also incompatible with medicinal hibiscus. Since hibiscus can increase liver enzyme activity, the body will metabolize seizure medications faster than normal. Hibiscus will thereby decrease the blood levels of seizure medications to a non-therapeutic level. So let's look at some herbal preparations for the use of medicinal hibiscus. We can use hibiscus as a tea. Medicinal hibiscus tea is made with 2 grams of dried hibiscus, steeped in 8 ounces of boiling water, for 2 to 4 minutes. This tea can be drank up to 3 times daily for 6 weeks to gain the benefits. Medicinal hibiscus extract can also be utilized. Extract should be dosed as 100 milligrams daily. So, who is hibiscus for? Adults? Yes. Children? Yes, in small doses. Those who are pregnant? No. Those who are breastfeeding? Maybe with caution. Remember, always ask your doctor before starting any new medication or supplement. Thanks for watching. Please consider subscribing to Medicinal Herbs Discovered. We post new top 5 videos every week, as well as a new herb of the week every Friday afternoon. Thanks, and happy watching!